Welcome to the Forum, live streamed worldwide from the Leadership Studio at the Harvard T.H. Chan School of Public Health. I'm Dean Michelle Williams. The Forum is a collaboration between the Harvard Chan School and independent news media. Each program features a panel of experts addressing some of today's most pressing public health issues. The Forum is one way the school advances the frontiers of public health and makes scientific insights accessible to policymakers and the public. I hope you find this program engaging and informative. Thank you for joining us.
Welcome. My name is Michelle Gershberg, and I am the U.S. Health Editor for Reuters. I'm also today's moderator. Our panelists, starting from my immediate right, are Howard Koh, Professor of the Practice of Public Health Leadership at the Harvard Chan School and the Harvard Kennedy School; Joseph Allen, Assistant Professor of Exposure Assessment Science at the Harvard Chan School; Vaughn Rees, Director of the Center for Global Tobacco Control at the Harvard Chan School; and joining us remotely, Karen Hacker, Director of CDC's National Center for Chronic Disease Prevention and Health Promotion. The event is being presented jointly with Reuters and is part of the Dr. Lawrence H. and Roberta Cohn Forum series. We are pleased to welcome Mrs. Cohn today. We are streaming live on the websites of the Forum and Reuters, as well as on Reuters TV. We are also streaming live on Facebook and YouTube. This program will include a brief Q&A, and you can email questions to the forum at hsph.harvard.edu. So today we're here to talk about vaping, a complex public health issue that is the subject of hot debate between its critics and supporters. More recently, the practice has attracted national attention and new regulation in light of the rapid uptake of vaping products among American youth. In fact, this is the third forum on e-cigarettes. Today, we're going to look at a number of facets of the vaping debate, including the skyrocketing youth vaping rates that we're seeing, the emergence of vaping-related lung injury and illness, the evidence that we have so far for vaping as a tool to help people quit smoking, the state of regulatory policies to keep up with a fast-moving market, and more. Last week, one of those new policies went into effect. It was a nationwide ban on some types of e-cigarettes. Let's watch a clip from last month when the ban was first announced. The clip is courtesy of Reuters.
In an effort to combat the rapid growth of vaping among teens, the Trump administration on Thursday announced the ban on popular e-cigarette flavors, including fruit and mint, but said the sale of menthol and tobacco flavors will be allowed to continue. The Food and Drug Administration is giving companies 30 days to stop making and selling the banned flavors, which are often found in convenience stores. The new ban will likely be a blow to companies like Enjoy, which offers flavors such as watermelon and blueberry. But it won't impact vaping industry leader Juul, which stopped selling fruity flavors in October after coming under intense scrutiny over the safety of vaping. U.S. health regulators have been investigating a mysterious respiratory illness tied to vaping that has caused 55 deaths and more than 2,500 hospitalizations, according to U.S. Centers for Disease Control and Prevention.
I think those numbers now are even higher, actually. So Howard, you have been a leader in tobacco control for much of your career. Can you give us some perspective on the current vaping debate within the larger picture of tobacco control?
Well, thank you, Michelle, and it's great to join my esteemed colleagues on this very important panel. So this is a tremendously complicated and fast-moving area, so it's important at times like this to take a step back and try to get a perspective on the status of tobacco regulation and vaping in particular. So just to remind everybody, it was only in 2009 that the FDA was granted authority to regulate tobacco for the first time, a really historic development because tobacco remains the leading cause of preventable death worldwide and still kills nearly 500,000 Americans a year. The focus initially was on combustible products like cigarettes, because non-combustible products like e-cigarettes were not even on the horizon back then. And very importantly, in 2009, flavored cigarettes were banned with the key exemption of menthol cigarettes. And we're going to be getting back to that, I'm sure, repeatedly through this webcast. So what's happened since then? E-cigarettes have come onto the market. Lots of interest about what its impact will be on public health. Many hope that it could be a form of harm reduction for smokers. But unfortunately, as Michelle has mentioned, we have seen very disturbing rises of use in youth. Recent studies show that more than 1 in 4 high schoolers use e-cigarettes, and this translates into some 5 million middle school and high school students. Flavored e-cigarettes have fueled a lot of that rise, and then of course Juul, based in San Francisco, started promoting its products, which are sleek and technology based and feature these cartridges or pods, and that's gotten tremendous attention across the country. This rise has really concerned parents and families and health officials, and we can talk about the health effects today and going forward, but there's tremendous concern that yet another generation of kids are getting hooked on nicotine. And then, as was mentioned last summer, EVALI, e-cigarette or vaping-associated lung injury, emerged nationwide, and we're going to be hearing much more about that from our colleagues as well. So in the midst of all this, what's been the status of regulation? The FDA gained authority to regulate non-combustible products like e-cigarettes for the first time in 2016, but chose to exercise what they call enforcement discretion. So these products are on the market, although they're not formally approved. In 2017, the FDA announced with great fanfare a proposed nicotine-based regulatory framework that could include e-cigarettes in addition to standard nicotine replacement therapy, and also potentially cigarettes with mandated low levels of nicotine below addictive levels. So that sparked a lot of interest, but that was proposed by former Commissioner Scott Gottlieb, who has since departed. And then last fall, in the midst of EVALI, President Trump announced his intention to ban all flavored e-cigarettes, but when the formal restrictions came out last week, as Michelle mentioned, this was just a partial ban on flavors in e-cigarettes. And the great concern here is that with a partial ban, it'll be very difficult to enforce and won't reverse the youth epidemic as we know it. In the midst of all this, states have stepped up, like Massachusetts. Just a couple months ago, the Massachusetts governor announced a ban on all flavored tobacco products, not just flavored e-cigarettes, but also menthol cigarettes. So that is getting lots of national attention. And so as 2020 moves on, this is going to be a very eventful year. May 12th, the FDA is requiring all e-cigarette manufacturers to file applications by that date proving or demonstrating public health benefit as a condition for staying on the market. So we're going to wait to see how all that proceeds. And then just a couple days ago, the Trump administration announced that they would favor moving regulatory authority over tobacco out of FDA into its own independent agency. So that's where we are right now. That's quite a 11-year period, and we have to watch this very, very carefully as we move forward.
Thank you. Joe, you have been studying some of these vaping-related illnesses, but you have also gotten into the e-cigarette research in a very interesting way. Can you tell us your story?
Yeah, happy to. So thanks, Michelle, and I share Howard's view. I want to say thanks. It's great to be a part of this forum. So I consider myself an accidental e-cig researcher. I direct the Healthy Buildings program here at Harvard. I've spent a career before Harvard doing forensic investigations of sick buildings, and it's actually a hidden connection between healthy buildings and the e-cig issue we're facing. So I'll tell you the story quickly. A couple years ago, I'm reading the New York Times, and I see an article that says there are 7,000 flavors on the market of e-cigs. And I had known from our work looking at workers in buildings and health that for 20 years now, we've known about the hazards of inhaling flavoring chemicals. This goes back to workers in a microwave popcorn manufacturing plant in early 2000. A physician noticed that 8 people had severe decrements in lung function. They did an investigation of this facility, and they noticed that workers in the mixing area in particular had developed, several of them developed severe and irreversible lung disease known as bronchiolitis obliterans. They started doing air sampling. They linked the causative agent to a flavoring chemical called diacetyl. Now, these workers were working over vats. The flavoring chemical, this fake butter flavor, was mixed with the kernels. They were inhaling these heated flavoring chemicals. And many, unfortunately, developed this severe disease. So I go back to this, more recently reading this New York Times article. I thought for sure someone had made this connection because we've known about this issue of inhaling flavoring chemicals for over 20 years. And there was nothing done or no research study produced. So we did what I think is the world's simplest study. We looked at emissions of e-cigarettes and to look for these flavoring chemicals. And sure enough, we found that in over 90% of the e-cigs we tested, we find these same flavoring chemicals that we know cause severe disease in workers who are inhaling them. These flavoring chemicals have a designation called GRAS, G-R-A-S, generally regarded as safe. That is for the ingestion pathway. They're not tested or approved for inhalation safety. And in our study where we find these flavoring chemicals, diacetyl, people think, well, maybe it's just the butter flavor. No, diacetyl has a lot of uses. It creates a lot of different flavors. In fact, we saw diacetyl in e-cig flavors like apple, cherry, peach, grape, other tutti frutti and other flavors that are clearly, in my opinion, are marketed towards kids, and menthol, and tobacco flavored, and that's relevant to the discussion on current policies and flavoring bans. But I think what most strikes me is that workers have been getting warnings about the dangers of inhaling these flavoring chemicals for a long time. This is the industry recommended warning, verbatim, warning. This flavor may pose an inhalation hazard if improperly handled. The handling of this flavor that results in the inhalation of fumes, especially if the flavor is heated, may cause severe adverse health effects. We don't see those kind of warnings on e-cigarette packages despite the same pathway. You heat a flavoring chemical and inhale it. Second, if I'm a flavoring manufacturer and I create some interesting flavor and you're going to sell this package up an e-cigarette or some manufactured food, when I send you my flavor, I have to send a safety data sheet that alerts you to the potential hazards and what protections you should have put in place for your workers who are mixing these. This includes hazard communication. This includes personal protective equipment like powered air purifying respirators. I've done investigations in other industrial facilities where workers have full face respirators on, like a firefighter would wear, similar to that. There's medical screening and surveillance, and it just strikes me as wholly inconsistent that we've known about this for 20 years. Workers have been getting these warnings for 10 years, and we don't give the same warnings to users of e-cigarettes. So it seems impossible that someone can make an informed choice without knowing what they're inhaling.
That's quite an image, the respirators. Karen, we're going to go to you. Can you tell us about the CDC's role in studying the health impact of vaping and how you and your colleagues are working to minimize some of the harmful impacts that we're talking about here?
Sure. I'm going to start out by talking about what we're considering to be 2 very different epidemics. We're going to talk about EVALI, which is the situation that we've recently had, which is the epidemic and the new phenomena, but really started in 2019 and then peaked in September of 2019. And good news is it's declining ever since then. And then I'm also going to talk about what's going on with youth in terms of their use. So back to the EVALI, as of February 4th, 2020, there was a total of 2,758 hospitalized EVALI cases or deaths that had been reported to us at the CDC from all 50 states, the District of Columbia, and 2 U.S. territories. There were 64 deaths that had been confirmed in 28 states and the District of Columbia. By and large, the EVALI epidemic was affecting young adults. The median age was 24, although we did see a range of 13 to 85 years. National and state data from patient reports and product sampling testing suggested that THC containing e-cigarettes or vaping products, particularly those from informal sources like friends, family, in-person or online dealers, were linked to most of the EVALI cases. In particular, as you probably know, vitamin E acetate was strongly linked to this EVALI outbreak. However, it's important to know that the evidence is not sufficient to rule out the contribution of other chemicals, including chemicals either in THC or in non-THC products. Our latest guidance, which I'll repeat here, is that CDC and FDA recommend that people not use THC-containing e-cigarette or vaping products, particularly from informal sources, as I've mentioned, such as friends, families, or online or in-person dealers. In addition, we want to constantly repeat the fact that e-cigarettes or vaping products should not ever be used by youth, young adults, or women who are pregnant. There's no redeeming way that that could be identified as something we would want. Now, as I previously mentioned, the youth e-cigarette epidemic is quite distinct from the EVALI situation that we found, and it is equally concerning. The youth e-cigarette epidemic primarily is affecting adolescents. It's being driven by the use of nicotine-containing products, obtained mostly from formal sources in this case. And it's been caused by a variety of factors, some of which have already been mentioned, including advertising, attractive flavors like fruit and candy, and the availability of easily concealable devices that deliver very, very high levels of nicotine. You know, the pods that Howard talked about could be easily hidden in your pocket, in your coat, and they could be used very discreetly, even within classrooms or at home. Youth e-cigarette or vaping products at this point has been on the rise since 2012. And we had the unprecedented spikes that we saw between 2017 and 2019. And as mentioned earlier, means that there are over 5 million youth that are currently using e-cigarettes. Put that in perspective, 30% of high school students and about 10% of middle school students are currently using e-cigarettes. So obviously this is of great concern to us. We know that nicotine harms the developing brain, and it's particularly concerning during the adolescent years. We also know that the nicotine salts that have been found in some of the products, particularly such as Juul, is much stronger than the historically free-base nicotine that was found in combustible cigarettes. So now we have young people who are not only addicted to nicotine, but they're addicted to much higher levels of nicotine than even found in combustible cigarettes. And as you probably know, we do not currently have an FDA-approved nicotine cessation product for young people. Our strategies have got to be similar to what we've used for tobacco, and we know it works. We know that making it less accessible, less appealing is critically important. We know that adopting comprehensive smoke-free laws that also prohibit e-cigarette use are very important. We've got to restrict advertising and promotion. But we've also got to recognize that there's a whole change in novel strategies related to technology and how young people get information and how they learn about these types of products. And we can pretty much guarantee that there will be something else on the market tomorrow. So we know that there's a lot more work to do, and we'll talk more about it as the panel goes on.
Thank you. Thank you so much. So Vaughn, just to turn to you for the other side of the debate, right? We've talked about the dangers to youth, but part of what makes this issue so complex is that there is still reason to think of e-cigarettes as potentially a safer alternative to conventional smoking, conventional tobacco products. Can you talk about what do we know about e-cigarettes in this context for smokers, and are the new regulations or the attempts to regulate leaving this community behind?
Thank you. I think that's a very good question, and Howard certainly helped us set the stage here in terms of helping us to think about the background to tobacco control. I think it is important, as we are considering issues and questions around vaping and regulation of vaping devices, that we recognise that tobacco, that is combusted cigarettes, are the real killer. The death rate in the United States is running currently at somewhere between 1,200 and 1,300 people per day. These are premature, preventable deaths that are attributable to smoking. We're at low historic rates in terms of the overall prevalence of smoking in the adult population in the United States. As Karen pointed out, we've got a lot of evidence-based strategies that we know work over several decades. We've seen that the rates of smoking in the United States moved down to somewhere around 14%, which is outstanding, and the United States is a world leader in that respect. Nonetheless, we continue to see vast disparities in smoking. The successes that we've seen in tobacco control have not necessarily been experienced by all members of our communities. And in particular, we still see very high rates of smoking among people of very low income background, the socioeconomically disadvantaged, and other groups that we would traditionally regard as being vulnerable, that is, people who have mental illness, people with substance use problems, people from the LGBTQ community, continue to smoke at rates that are vastly higher, 2 or 3 times the rate of the general population. We know that quitting smoking is hard, and even with the best evidence-based interventions available, somewhere fewer than 10% of people who make a quit attempt are still able to achieve abstinence at the end of 1 year. What this is telling me is that we need opportunities, we need to provide alternatives to adult smokers to reduce their risk of illness and premature death, and to think creatively about innovative strategies, of which vaping devices happens to be one. The opportunity to deliver clean nicotine to adult smokers in a way that can support them transitioning away from the vastly more harmful exposure to combusted tobacco smoke is something that we continue to need to think about very carefully. The challenge, of course, is, and I absolutely agree with all of my colleagues here, with Joe, with Karen, and with Howard, is we need to keep these devices out of the hands of kids. Compared with not vaping or not smoking, any level of vaping, of course, in adolescence, particularly in adolescence, is potentially risky, and so we need to continue to strive to implement strategies that keep vaping devices out of the hands of kids, but we need to do it in a way that doesn't disenfranchise adult smokers. So that we can continue to drive down smoking rates and prevent the vast number of premature preventable deaths that smoking causes in the United States each year. So how do we do this? It does require many of the strategies that we've touched on today. We need proper regulation of these devices. Vaping devices need to be cleaned up. The FDA is looking very carefully at strategies by which they will regulate vaping devices, and I expect that product standards will be introduced in the future as we understand the way in which these products function and the sorts of constituents that are being that they are exposing consumers to. We also need to communicate the risks very clearly, and I think much of the recent communication has highlighted risks that adult smokers are not necessarily exposed to. EVALI, for example, or the risks of flavour-based compounds are vastly lower than the risk for adult smokers of continuing to smoke. And we need to help adult smokers to understand that vaping devices may indeed still offer a viable alternative and a preferable alternative over smoking.
Thank you. So we are now going to take a more detailed look at some of the issues that our panelists have raised. To get us started, we're going to watch another clip. This is a clip in which a young man describes his own experience with the Juul e-cigarette. This clip is also shown courtesy of Reuters.
I couldn't focus on my schoolwork at all because all I was focusing on was just trying to get more nicotine, and my grades actually fell pretty far behind because I just wasn't focused at all. I was just focused on getting another hit of the vape.
17-year-old William Smith says he became addicted to vaping, Juul his brand of choice. He started when he was 15, and at his peak, Smith says he was using one flavored Juul pod or more every day, inhaling the same amount of nicotine found in a pack of 20 cigarettes.
Yeah, no one thought it was bad. No one knew what it did, so at the time, yeah, everyone thought it was just like a good thing that made people happy and less stressed.
It's really not wonderful.
The Trump administration in September announced plans to ban all flavored e-cigarette products, which have been criticized for appealing to teens, following a U.S. Food and Drug Administration warning that Juul was misleading consumers by marketing its products as safer than cigarettes. Juul responded by halting U.S. sales of its flavored pods, except for mint, menthol, and tobacco flavors. But when Smith was vaping, the fruity and sweet flavors were popular.
People would just randomly ask me in the middle of class if they could use my thing, just out of nowhere. Just throughout the entire day, people were just asking if they could use it, and that just continued on because everyone was addicted. It's bad.
Juul is under fire from critics who say it helped create an epidemic of teenage nicotine use.
So no one thought it was bad, and everyone is addicted. This is what we heard from William. And it suggests to us that people, including many youth, may not realize how addictive these vaping products can be until it's too late for them. Can we talk about the new U.S. ban that's been put into effect? Do we think that it's going to help prevent additional teen use? And what do we do about young people like William who've already become addicted? Howard, would you like to?
So as I mentioned earlier, the hope was that the flavored e-cigarette ban would be a complete ban and really be easily understood and easily implemented. But the fact that the FDA has announced this partial ban last week creates a very complicated landscape right now. So for example, menthol is still exempted from that ban. Other products like disposable e-cigarettes are exempted from that ban. And so it creates a very, very complex arena. And it's going to be very challenging, I think, for the FDA to do this in a comprehensive and effective way that reverses the youth epidemic that we're all so concerned about. Let me give you one example of some of the debate. With menthol being exempted, some would argue leave menthol alone in e-cigarettes because menthol cigarettes are still on the market, and if you ban menthol on e-cigarettes, it'll just push people who are vaping back to a more harmful product. But a response to that would be to eliminate menthol in cigarettes as well, and just take all those flavors off the market. And that's what's been announced by the Massachusetts governor here, a ban on all flavored tobacco products, cigarettes and e-cigarettes. And so we're going to watch that carefully. We have some colleagues in the audience who will be evaluating that ban here in the state as we move forward. And we also are looking to see what other states are going to do as this federal ban a partial ban goes into place.
Vaughn, do you want to talk about what we know about nicotine and youth addiction?
Sure. Obviously, it's a very great problem, and the recent uptick in youth vaping is particularly alarming. We know that nicotine dependence can have profound effects on young people's development, on the developing brain. It does increase the risk for dependence or use of other nicotine products in the future, as well as engaging in other types of substance use. We know that the experience of nicotine withdrawal, which accompanies nicotine dependence, can undermine a lot of routine tasks, including educational responsibilities or obligations, social activities, restricting or restraining kids' behavioural repertoire, and causing long-term impacts on their overall development. Treatment options for young people, for adolescents, is somewhat limited, and there's no question that this is a profound problem. I would add this though, the rates of youth that vape on a daily basis are quite similar to the rates of young people who smoke. So I think that we shouldn't perhaps overestimate or overemphasize the risks of vaping among youth compared with smoking, and we shouldn't lose sight of interventions that continue to be required to help to prevent youth smoking. The sorts of strategies that have been very effective in reducing youth smoking, also to historic rates, should be and can be applied to vaping products. Restrictions of flavours have already been applied to tobacco products. There was a time in recent years when candy flavoured, exotic flavours, fruit flavours, alcohol flavoured cigarettes were available for young people. Those are now banned by the FDA. We can apply similar bans to the vast range of flavoured vaping products to help to make them less appealing to youth. A recent ban by the federal government has increased the age of sale of all tobacco products, which includes vaping products, from 18 to 21. And that will have profound impact in reducing demand and access among young people, both for cigarettes and for vaping products. So we're working, I think, with the federal and state regulatory authorities are working very well towards imposing or implementing strategies that will continue to arrest the rates of use of both vaping products and combusted tobacco products. But again, I come back to the need for providing clean nicotine for adult smokers to help them reduce their risk of smoking-related illness.
You raise several important points, and one I wanted to bring to Karen. We sometimes talk about the youth vaping epidemic in a vacuum, as if it's separate from youth, the attraction to smoking. And how do you understand those two trends working together? And also, what is CDC? What is CDC's approach to advising, on a public health level, how to help youngsters quit when, as you've said, there's no real approved product to do that?
So I'll start with what are we doing to monitor this scenario, which is obviously very fast changing. So everybody may be aware that, we've had this annual survey called the National Youth Tobacco Survey, which has been a collaboration with FDA, and that's really been the gold standard. But the challenge, of course, is that that's a once a year survey, and that hasn't really been able to identify new and emerging trends. So we are really getting much more involved in considering sales data, in looking at social media, using web panel surveys to complement our efforts in order to determine whether there are new products that are coming online, whether or not there's a very fast shifting change in the use of certain products as well. In addition, we're very interested in trying to understand what these regulations that have now been put forth, what the impact of those are. One thing that people may have already heard of, for example, that I haven't heard mentioned yet, is the puff bars or the single-use e-cigarettes that apparently also can continue to have flavors. And we have heard stories from people in the educational system in particular telling us that young people are going after those. Those are currently not included in the current regulation. I do also want to mention that the vape shops are excluded from the regulation, and we have no way of to monitor those at this point in time. The last thing I'm going to just say in terms of what's available for prevention, as I mentioned, there's all the things that we've been doing with regard to tobacco. I think the challenge right now, and as an adolescent medicine physician on top of it, is what can we offer young people who are currently addicted to nicotine? As you know, there is no cessation products that have been FDA approved for this population. We do know that there's off-label prescribing that's taking place. And obviously that is happening between the physician and the young person. There are a number of organizations that are working on mobile devices to provide curricula, et cetera, to help young people get off of the nicotine that they're now on. As I mentioned earlier, these extremely high levels of nicotine that they were getting through the products, as mentioned earlier.
So to go back to the high nicotine and also what the product is. I mean, maybe Joe, this is a place you want to talk about, what we're seeing, what are these ingredients? Do we have real regulation that's beginning to address that piece of it? What is this item, right? Yeah,
well, I think that's been a lot of the problem here, and I'm glad we're having this discussion about relative and absolute risk, is that, we always think, well, they're safer than e-cigs are safer than cigarettes, but everything's safer than a cigarette. And so it gets the discussion of absolute versus relative. And I think we've been given this message for a long time now, maybe to youth, that maybe safer equals safe. And that gets to this question of what are we really disclosing, or what do we understand about what's in the product? And I'll give you an example for some leading products that are out there. The ingredient label has 5 seemingly simple ingredients. One of those is just flavors. All right, so I earlier talked about the issues of inhaling flavoring chemicals. There was a study published last year that found over a dozen, what these authors call harmful or irritating flavoring chemicals in some of these leading e-cig manufacturing product. So that word flavor is doing a lot of work. The Industry Flavoring Association, to protect the respiratory health of workers, has identified 27 high priority flavoring chemicals that they know injure the lungs, and so workers again are protected from this. Again, that's all hinted under flavors. But I want to talk about something that no one is really talking about. We've been talking about flavorings for a couple of years now. There's a second ingredient on there called propylene glycol. Propylene glycol is the carrier fluid, constitute the vast majority of the e-liquid. When you heat propylene glycol, you can generate formaldehyde. Our study a couple of years ago showed this. Many others have seen this now. Formaldehyde, of course, is a carcinogen, causes wheezing, burning sensation in the throat and nose. And we found formaldehyde at levels that exceed what we call a ceiling limit for workers. A ceiling limit is a level that workers are not allowed to be exposed to even for 1 second. There's something else with propylene glycol that no one is talking about yet, and I'm glad we have this forum to share it. In that paper, we looked at secondary formation of toxics from propylene glycol, and we showed, theoretically, you could generate a chemical called methylglyoxal. It turns out a paper a couple months ago by these same researchers who first discovered popcorn lung, now 20 years ago, showed that methylglyoxal is more toxic than diacetyl, the chemical associated with popcorn lung. And they're chemical cousins. They are related. They are alpha dicarbonyls. So related chemical, and these authors were surprised. They tested the toxicity of diacetyl and the toxicity of methylglyoxal. Methylglyoxal is being produced in our testing. 100% of e-cigarettes we've tested generate methylglyoxal. Others have seen this too. In fact, there's a really interesting study that looked at the saliva of vapors before and after they vaped. And they find methylglyoxal after they've vaped. So we have this whole connection here with this propylene glycol on the label, what's behind that. And we see mechanistically it makes sense, theoretically. We've measured it in emissions of e-cigarettes. Others have seen this actually in the body of vapors. And it's not really talked about because the ingredient label gives this maybe, well, certainly it's an incomplete description of what's coming out of these e-cigarettes. And so how can, like I said in my first answer, how can anyone really make these decisions about what's okay, or if I'm thinking about different smoking cessation approaches? And I look at this label, and kids probably do this too. I say, well, flavors and these other, only 5 ingredients, well, maybe that's not all that bad. And meanwhile, the science is telling us something quite different.
I think Joe is making very good points. Exposure of any of these constituents in young people who don't use other substances is extremely problematic. What we also should point out is that most, if not all, of the constituents Joe pointed to exist in the emissions of combusted tobacco cigarettes. In some cases, in orders of magnitude greater than are seen in vaping devices. So again, although there is no safe level of exposure, the point is that smokers can reduce their risk of exposure to these constituents by moving to a less harmful form of nicotine delivery. And I think that is part of our challenge, is communicating to the right constituency, to youth, not to use these products at all, but to smokers, that there may be some relative advantage in discontinuing smoking and using a product that lowers their overall exposure to these otherwise very harmful constituents.
So Vaughn, you've also talked about using these products as a way of helping people transition, right, away. Are the policies that we have in place, do you think that they're helping guide industry towards developing products and innovative products that will really help somebody move not just off of tobacco, but also eventually off of nicotine addiction? Is there a transition product that we're environment that we're fostering?
Well, ironically, some of the big vaping device manufacturers have suggested that they may be able to achieve that, but in reality, they've instead chosen to market their products to young people. So we haven't seen that promise delivered. And I think the current regulatory environment makes it very challenging for the manufacturers of vaping devices to develop products that may succeed in that mission. But I'm optimistic that as we move forward, federal regulators will find ways to identify mechanisms to understand how vaping devices may support smokers in permanently quitting smoking and moving to a less harmful device. Manufacturers of vaping devices will be submitting pre-market applications to the FDA to demonstrate how and why their products are in the interest of the public health, and that may be informative in terms of helping us understand how they may support reduction in risk for adult smokers.
Howard, is this a particularly tough market to regulate?
It's a tough market because, as I mentioned, because of the decision in 2016 to exercise enforcement discretion, these products are on the market and causing now these tremendous problems among youth uptake without regulation. And so that's why May 12th is very, very important. Getting these applications in from the manufacturers, having the FDA finally do formal evaluation as a condition for these products to stay on the market, that's all very, very critical. I think also, and maybe I can get into this now, Michelle, with this federal activity going on, it's very important to keep our eye on the states and the cities. So I've mentioned Massachusetts now a couple times, but we have states like Michigan and New Jersey that have banned flavored e-cigarettes. We know that states like Rhode Island and Montana and a number of others have also taken action. So for all those activities, we need to follow what's happening, evaluate it, see if we have lessons learned that can inform other states and indeed the country at large. And then it's very important to note that in San Francisco itself, there was an announcement last year that they would ban all e-cigarettes in that city starting last month, January of this year. And that led to opposition from Juul, because Juul is based in San Francisco, and it went to a ballot initiative, and the people of San Francisco voted overwhelmingly to maintain that ban. So it's very, very complex. I think the evaluation and the science of all this is critically important, and we need to track this going forward to see how it all relates back to hitting the bullseye of ending smoking for the future.
Thank you. Karen, I'm wondering if you can share some new details about the CDC investigation into EVALI, the vaping-related illness. And I did want to pick up on a point from Joe as well, which is we have EVALI that has been associated with THC, illicit THC use, informal products or illicit products, but there are also suggestions, are there elements or chemicals within the more conventional products on the marketplace that we need to be concerned about?
So let me talk a little bit about what happened to give you a flavor for how we actually approach this problem, no pun intended there. On August 1st, 2019, Wisconsin first alerted the CDC about a cluster of pulmonary injury among young adults, and that had begun in July of 2019. CDC implemented an incident command structure at that point. And then on September 16, 2019, we activated our Emergency Operations Center, which allows us to bring in more dedicated staff and resources to help with the investigation. We pulled in scientific expertise from across our agency to focus on the epidemiologic, laboratory, and clinical realms. And we were working with many, many organizations across the country, at the state level, at the national level, and letting the public know what was going on as we were able to understand it. Our response efforts mainly focused on identifying and defining first and foremost the risk factors and the sources for e-cigarettes and other vaping products that were used in lung injury. As you may know, it is very challenging because, for example, we might get a web address. As soon as we got that web address, it was gone, literally. So identifying where these products came from was extremely challenging. Simultaneously, most of the individuals who were ill had used multiple products. There wasn't one flavor, there wasn't one particular product. They used both things that they got off the web, THC, but then they also used some of the more conventional products as well. We were detecting and tracking confirmed and probable cases with the help of all of the states and localities that were involved. And we were communicating that information on a regular basis. And then the laboratory studies began as samples came in. And that was really what helped us identify that the vitamin E acetate was particularly concerning to us. All of that information was being put out regularly to the public. I think sometimes there's a frustration that things weren't happening fast enough, but we really needed to know that our evidence was strong while we released this information. And so our messaging to the public was, for the vast majority of this time, was to avoid using e-cigarettes because we did not know what chemical components were causing the problem. By the time the EVALI situation seemed to be dissipating, which is, literally within the last several months, we were pretty clear that vitamin E was at least one of the major culprits. But again, we're still saying that there may be other chemical additives. The biggest concern we have at this point in time is that while vitamin E may disappear, there may be other additives that start to get included as well. It becomes very difficult to know where that's happening. Are people filling their own devices? Are they using informal devices? Are they using devices that they could purchase and that they can fill themselves in terms of the refill pods? All of those types of questions that come up.
Thank you. So we are now going to turn to our Q&A portion. We've been receiving questions online. And the first actually kind of piggybacks off what we were just discussing. This is from Jeffrey Drazen of the New England Journal of Medicine. Are there essentially two different illnesses? The recent one, likely caused by contamination in so-called juice, and a more insidious one without explosive onset, but at a low frequency, and likely causing an irreversible lung disease. If so, the latter may be a bigger threat to our population. Joe, is this?
Well, yeah, I think I appreciate that perspective, and that's been my concern. There's been so much attention on e-cig and this lung disease around vitamin E acetate, and rightfully. But it seems as the cases are dropping that we're ignoring this other scientific evidence that suggests, and without exaggeration, that millions of people are inhaling a cocktail of chemicals that we know cause injury to the lung. And if you look at going back to workers, and it's not just popcorn workers, this is going on for decades now, and it's not just acid, it's a whole mix of flavoring chemicals, and many that don't appear in cigarettes. You find that the workers, or that the illnesses go beyond this irreversible lung disease of bronchiolitis obliterans. In fact, many of these people have developed asthma as a result of inhaling these flavoring chemicals, chronic bronchitis. So these are things that wouldn't be captured in the current surveillance system, but speaks to the comment here that there's this low-level underlying chronic exposure that's occurring, and there are other diseases that our current surveillance system are most definitely not capturing.
Can I just add something to this? I think for us, there's no question that the EVALI situation was a unique phenomenon. But it does bring up this question of somehow a chronic, more underlying issue that may be going on for a much longer period of time and much more subtle to detect. We do know that there were a number of other chemicals that were identified. We talked, there's heavy metals, there's other things that have been identified. And one of the biggest challenges is that the consumer generally does not know what they are inhaling because it is not labeled as such. And as a result of that, it becomes very difficult. And then, as I said, the concern that there may be new additives that may be coming in to stretch whatever is being stretched, and the consumer will not be aware of this either.
So our next question comes from Susan Almy from the New Hampshire House of Representatives. She's asking whether the federal system is biased against low-cost treatments provided by low-margin operators, such as shops run by ex-vapers who are trying to help others quit. Does this freeze out all of the research on the efficacy and relative safety of using vaping in open systems in a way that would reduce nicotine content gradually to zero and then help try to wean the user off of inhaling? Is anyone working on this?
Well, there is a considerable amount of research going on helping us to understand how different systems function, how they deliver nicotine to consumers, and the impact on use behaviour, including dependence. That research, though, I think it's important to point out, is not generated by these small manufacturers. The small manufacturers will face the difficulty of having to submit by May of this year a pre-market application to continue to the FDA to continue to stay in the market. My understanding is, or my expectation is, that most of them don't have the resources to demonstrate that their devices are in the interest of the public health. So whether or not they have products that may be advantageous to adult smokers in reducing their risk, we may not know. Independently of their innovations, there is some research going on, but it may not be sufficient for us to completely understand the full scope of the issue.
Can I also add to that? I do want to point people to the most recent Surgeon General cessation report. It literally came out several weeks ago, and there is a very comprehensive assessment of the current knowledge of the efficacy of e-cigarettes for cessation. And the bottom line is, at this time, the evidence is not ample to be able to really say that these are cessation devices. So clearly there is more research that needs to be done.
Thank you. So we have a new question coming from Meredith. Has Professor Allen's research been presented to the Center for Tobacco Products at FDA? And if so, what kind of response have you received?
Not specifically there, but I'll tell you, we presented it just about everywhere, and I'm proud to say our paper is still the #1 read paper in environmental health perspectives for 5 years running. I think this knowledge is out there. It's not like this is a secret. And in terms of the response, I will say the response has been quite interesting and this is a little bit of a switch of the topic, but as many researchers in this field and other fields get when it's a controversial or a difficult topic, there have been pushback. There's been letters to my dean about our work. There's been industry consultants rebutting our work, or trying to rebut our work anyway. So this is this is a heated topic. And so our work is all out there, and certainly has raised the attention of some manufacturers. So we're certain that it's reached a wide audience. Yeah.
Okay. So here's a question from Daniel Wickler, I hope I'm pronouncing it correctly, of Harvard Chan. Critics of CDC allege that nicotine addicts who had switched to e-cigarettes were driven back to smoking as a result of the various state responses to the temporary advice that no one should vape. Do you agree that that was a serious misstep on CDC's part? Did it occasion a review within CDC to understand how this happened, to ensure that CDC's advice on vaping can be relied on in the future?
I think it's very important that everybody realize that from the perspective of the CDC, we do not want anyone to go back to smoking. We don't want people who never went to smoking, such as young people, to go to smoking combustible cigarettes. And we certainly don't want people who are using vaping as another means to go back to cigarettes. At this point in time, I do not believe that we have evidence that in fact that is occurring. Although we are, as I mentioned earlier, looking at sales data and things like that. Probably know that at least for young people, smoking combustible cigarettes has been at an all-time low. I think the challenge is to remind ourselves that many people who are vaping are also smoking at the same time. They're doing what we call dual use. And that has also made it very difficult to assess the value of e-cigarettes in particular as a cessation device. So from our perspective, again, we do not want, or we do not suggest, we do not in any way support the idea that individuals move from vaping back to combustible cigarettes.
Okay. So I think we're going to go into our wrap-up mode right now. Perhaps we can have a couple of words from each of you on, what kind of takeaway solution or message you might give us in this debate. Vaughn, do you want to start?
Sure. I think we've seen important successes in tobacco control, driving down rates of smoking. However, those successes have not been shared among all, and finding ways to support discontinuation of smoking, particularly among vulnerable populations, is a concern that I have. Finding ways to deliver clean nicotine through a properly regulated, properly communicated in terms of the health risks, innovative device, I think, may be critical in helping us to achieve those outcomes. But we want to do it in a way that does not increase interest, demand for, or use of these products among young people. We have seen in some jurisdictions, for example, in the United Kingdom, I think a more proportionate response in the way vaping devices are regulated relative to combusted tobacco products, and those sorts of lessons may be helpful in the United States as we think about ways to keep them out of the hands of kids, make them as low risk as possible, and communicate the risks accurately to adult smokers to help support them in reducing their risk of premature death and disease.
Sure. So thanks for having us at this forum, Michelle. So yeah, I learned a lot here too, because that's the first time I've heard that these are not proven to be a smoking cessation tool. So I feel like I haven't had complete information. And while the other end of that, there is evidence these are smoker creation tools. And I think that's really important to keep that in mind, because that gets to my series of what I think are three reasonable and prudent recommendations. First is we have to always consider the absolute and relative hazards here, right? And that's even for smokers who are trying to quit, so that they can assess which pathway is best for them. But we can't get there until we have full transparency and disclosure. And here we need to require manufacturers to disclose not just what's in the e-liquid, but what is being emitted, because that is ultimately what's being inhaled. And when we do that, it goes way beyond a handful of ingredients. And the last thing I'd say is maybe the most disturbing thing to me here is the knowledge, and having seen this firsthand, that the protections, the effort that we go to protect workers from inhaling these flavoring chemicals, and giving warnings, and this is from the industry itself, that it seems reasonable, at a minimum, we should be giving those same warnings to users of e-cigarettes who are following that same pathway of inhaling heated flavoring chemicals.
Howard, some thoughts?
So we have a very busy year ahead, and everyone needs to follow this very, very carefully, because there's so much at stake with respect to public health. I think my overall comment is, as there's more attention to regulating e-cigarettes at the federal, state, and local level, everybody should keep in mind, how does this relate back to combustible tobacco products? My colleague Cliff Douglas and I have written that the key here is to remember that the bullseye is ending smoking. And if we keep that broad perspective, we know that our overall goals are to protect kids, reverse this current epidemic for them, keep them tobacco-free and substance-free, help smokers, help them to quit, and reduce harm as much as possible for them going forward, and then try to denormalize this epidemic that's robbed so many people of good health for far too long.
Karen, will you wrap us up?
Sure. We've heard a lot today, and I think hopefully the audience has gotten a pretty good understanding of what some of the efforts have been and what's been going on. I think from the perspective of the CDC, we recognize that we must be more proactive in tracking any new tobacco products as they appear, understanding how they are affecting the population, and in particular young populations, so that we can mitigate the risks effectively. We've got to be using new technology, because that's how we communicate now with adolescents. And I think that the strategies that have been mentioned today in terms of what is available as FDA-approved cessation, what could potentially be available for young people in particular, and all of the comments with regard to how best to think through the contents of this incredibly varied market is going to be very important going forward.
Thank you. So I would like to thank all of our panelists and our audience, both in the studio and online. Before we go, I'd just like to say that next week the forum will have a Facebook Live Q&A about the new coronavirus outbreak on February 19th on the forum Facebook page. That will be followed by a full forum on the virus on March 2nd, and then tune into the forum again on March 18th for a discussion about homelessness in America. Thank you very much.